Welcome everybody to day 3 of our 2020 virtual campaign kickoff. We're so excited to have everybody here with us today. As promised, we have a panel of rock stars from our health community. So today is going to be the health of our community, and I've got a number of rock stars to introduce to you today. Let's get up their bios here and close down a few screens. Okay, let's start with today's panelists. We have Missie Boone, and she is with the Crisis Resource Center. Holly Jorgensen is with Let's Smile. We have Vela from the Free Clinic of Steele County. Edna Ringhofer with Healthy Seniors of Steele County. And we have Kassy Nielsen with SCHRC. And I shortened it a little bit, Kassy. Okay, wonderful. Well, help us welcome our panelists today. We appreciate everybody that was able to hop on. I'm gonna go ahead and turn it over to Tom.
Well, thank you so much, panelists, for being here. Just a quick note on the format here. We're going to share the questions and really open it up for any panelists to answer it. We don't want to put anybody on the spot. If we have to, we can start calling on folks though. So the first question that we got from members of the community was that social distancing has become such a common phrase during the COVID-19 health crisis, but there's been a discussion that maybe physical distancing is a more effective term. Panelists, what are your thoughts?
I guess I'll jump in. Being that we meet with clients and we develop treatment plans with them, this is an interesting question. So I thought, when I read it, I was like, well, yeah, physical distancing actually seems a little more effective of what we're doing. Since we have a lot of clients centered around improving social skills. So when we're able to meet with them face to face with our social distancing in place, being that we physically can't touch them or be very close to them, and just kind of knowing that a lot of us, when we meet with them face to face in the community, we're working on those social skills. So it's interesting to see that, just knowing that keeping our physical distance has really, really been important for us through all this. So kind of taking that away from the actual social term. So that's just, it was an interesting question. So I thought, physical distancing actually seems a little more prevalent for us. So
I'm going to second what Kassy just said. I really like the term physical distancing versus social distancing. I think we're all very social people, and I love socializing with everybody, and physical distancing is just a much better term. Yeah, I like that so much better.
I can jump in. With seniors that we serve, the physical distancing is probably better as well, primarily because they are so isolated. So the more we can make contact and come into the home, you know, obviously following the COVID-19 rules, but having that one-on-one, face-to-face contact is so valuable, and we appreciate being able to do that.
I can jump in too. I like the term physical distancing better too than social distancing, because like Holly said, we are social people, and it's important for self-care and for the mental health to, you know, be social and not be isolated. So I agree.
Lee, any final comments on that question before we move on to our next question?
Yeah, I was hesitating whether I should jump in or not, but yes, a lot of the people that we see here at the Free Clinic, some of them might come from another culture, and the fact that we're physically distancing, that's a great term. It makes things a little bit more difficult because they're more social, they're more, I guess, touchy-feely, and you know, if you make not seem to come off as very genuine if you're not willing to, give a hug or give a kiss on the cheek or, other social norms and mores that are common in those cultures. So that is a bit of a struggle. And at least here in the free clinics, in the past, when we had people come in, we would have 1 or 2 patients, and then we would have extended family members come in. So sometimes we would have anywhere from 2 to 3 people to sometimes a dozen people or more to accompanying one individual. So given what we're going through right now, that is no longer the case. So it's a bit difficult.